I'm Abby Ballard, and our topic is the effect of propranolol on diabetic wounds.
And I'm Mckenzie. So for a little background on what diabetes mellitus actually is, it's also known as type 2 diabetes. It is a strong predictor of cardiovascular disease and associated with micro and macrovascular complications. Due to the negative effect of DM on the cardiovascular system, cardiovascular disease causes about 70% of all deaths in people with diabetes mellitus. DM is caused by postprandial hyperglycemia, which is just a fancy word of saying overeating. It is also due to having a disturbed metabolism of protein and fat. The number of DM patients increases as a population increases due to the increasing prevalence of obesity. DM actually accounts for a large percentage of patients diagnosed with heart failure. DM creates hyperglycemia, which leads to the increase of urination that then causes the decrease of blood flow in vessels. DM also limits PNM functioning, which is a type of white blood cell that secretes an enzyme that helps with infections, allergic reactions, and asthma. PMN is also an enzyme we need in our bodies to help tissue repair, as well as to prevent wounds from being infected. Studies on injured tissue actually show that there is a delayed response in injury and impaired functioning of immune cells in patients with diabetes mellitus. Diabetic wounds actually show stronger expressions of pro-inflammatory cytokines, which are a type of signaling molecule that is secreted by immune cells, white blood cells, during the beginning and end phases of tissue repair. All in all, diabetes mellitus delays wound healing.
Propranolol competitively antagonizes beta-1 receptors in the heart, which is shown here with the beta-1 receptor and propranolol. And this prevents vasodilation and slows heart rate and decreases blood pressure. And then this also reduces the amount of work it takes for the heart to pump blood. Propranolol also blocks beta-2 receptors in the bronchioles. This causes narrowing that may cause difficulty in breathing for those with pre-existing respiratory issues. When propranolol is used in the medical field, it's used as a pain reliever, and it's much more likely than other beta blockers to cause vivid or unusual dreams. It's often used with other medicines for hypertension, and it helps with migraines and tremors. It's approved for treatment of essential tremor, and it only slows the intensity of tremors, but not the amplitude. When prescribed, it's usually prescribed in a dosage of 30 to 320 milligrams and needs to be used with caution for those with diabetes and thyroid disease. This is because the use of propranolol can mask the symptoms of hyperglycemia, which is low blood sugar, and hyperthyroidism, which is high thyroid levels. On the molecular level, this is what propranolol looks like, and then this is the formula for propranolol.
Okay, so moving on to the experiment portion of our poster, I'm going to be talking about what the experiment actually was. So this experiment was performed by the Department of Histology and Embryology at the State University of Rio. This tests the functions of the drug propranolol on the wounds of diabetic rats. So the first off, the experiment starts off with the rats receiving an injection of streptozotocin into their abdomen, which then induces them into acute diabetes. Then the rats were put into a drug-induced coma caused by an injection of ketamine and xylazine before the wound was made. A control group and propranolol group were given the same amounts of water. And in that water, each rat received a solution of 6% sucrose to heighten their blood pressure, since in diabetes you do have high blood pressure. Now, based on the rat's daily water intake, 50 milligrams of propranolol was dissolved into 50 milliliters of water to guarantee full intake of the drug. The administration of propranolol began 1 day before wounding and was maintained daily until euthanization. At day 7, the rat's blood glucose levels were measured, both control and propranolol group. They proceeded to record the measurements of the wounds, for both groups after day 7 and day 14. The wound area was measured weekly until the rats were killed 14 days after wounding.
The results showed that propranolol injections improve wound healing in hyperglycemic diabetic rats by reducing the inflammatory response and improving phases of the repair process. The wound area was not completely healed in either group after 14 days. However, the wound was significantly smaller in the propranolol-treated group both 7 and 14 days after the wounding. The percentage of the original wound was 14% smaller at 7 days and 35% smaller at 14 days, as shown in the graph in the propranolol group. Also, the pictures show how much smaller the wound was compared from the propranolol group and the control group at both 7 and 14 days as they were measuring the wounds. Both of the groups lost weight during the experiment, but there was no significant difference found between the two groups. And there was also no difference in blood glucose levels by the end of the experiment. Our hypothesis for this experiment was that propranolol will increase the dilation of blood vessels, which will lead the wounds of diabetic mellitus subjects to heal faster. Our hypothesis was correct because as the blood vessels dilate, there's more blood flow to the wounds, which causes the healing process to happen quicker than it normally would.
So also part of the results, it shows that the percentage of blood vessels in the wound regions are less in group A, which is the control group that does not contain the drug propranolol. And as you can see that there are less blood vessels that are dilated. They are constricted in this picture right here, so that means less blood flow and it would take less time for them to heal, versus group B, which you can clearly see the blood vessels are dilated, so that means there's more blood flow and the wounds will be able to heal faster. In conclusion, factors such as age, obesity, malnutrition, and cardiovascular disease may contribute to the delay in healing of wounds, especially in people with type 2 diabetes. In addition, patients with DM have low insulin levels and high blood sugar, which affects the cellular response to tissue injury. This experiment proves that the drug propranolol does help speed up the healing process in patients with diabetes mellitus. Although this specific experiment is dealing with rats, future developments may open this concept for humans as well. Propranolol has many functions in the medical field and must be used with caution in some patients. Propranolol will specifically be used in patients with diabetes mellitus to treat high blood pressure that comes with having DM. This will ultimately improve the speed of the wound healing process in patients with diabetes mellitus. To this day, scientists are still researching the effect of propranolol on humans.
So you might be thinking what all of this means for the future. Because of the significant difference between the control and propranolol groups in this experiment, it is likely that this knowledge will be further used in humans, resulting in faster healing for individuals with DM. Scientists are researching ways to utilize propranolol in patients with DM. However, they are still working on using this very efficiently. Currently in the medical field, propranolol is used to treat migraines and tremors. There is potential for this to become essential for people with DM. This would ultimately decrease blood pressure and increase blood flow to wounds.